In this lecture, we'll talk about male sexual dysfunction. When we say male sexual dysfunction, most people will think of erectile dysfunction. But actually, when we say male sexual dysfunction, this includes several sexual problems. Erectile dysfunction is certainly one of the most important ones, but also there are other sexual dysfunctions such as premature ejaculation, delayed ejaculation, and reduced libido. The focus of this lecture will be mainly the erectile dysfunction, but we'll also touch on other sexual dysfunctions in males. Many medications can cause sexual dysfunction in males. Here we have a list. Cardiovascular drugs. Almost all the cardiovascular drugs cause some sort of male sexual dysfunction, except ACE inhibitors and ARBs. So as you can see here, we have a list: beta blockers, alpha blockers, clonidine, spironolactone. Lots of the medications that we covered in the cardiovascular system: digoxin, acetazolamide, calcium channel blockers, hydrolazine, thiazide diuretics, clofaibrate. Also, CNS medications include benzodiazepine, levodopa, phenytoin, carbamazepine, barbiturates, antidepressants, except mirtazapine and bupropion. And this should not be a surprise because we already mentioned that these medications are used for patients with issues with sexual dysfunction if they are taking other antidepressants. Lithium, antipsychotics, and opioids. Endocrine medications that will affect the estrogen. So we have 5-alpha reductase inhibitors, gonadotropin releasing hormone agonist, androgen deprivation therapy, such as glutamide, bicalutamide, and nilutamide. These are medications used for prostate cancer. These medications shut down the testosterone production in the body. That's why we call it androgen deprivation therapy. Other medications or other medications that can cause sexual dysfunction include alcohol, acute consumption reduce erection, and chronic consumption reduce sexual desire. Methotrexate, marijuana, cimetidine, ranitidine, steroids, cocaine, ketoconazole, and cyclophosphamide. And as we mentioned before, when we say that the drug causes male sexual dysfunction, this doesn't necessarily mean erectile dysfunction. This may be a wider range of symptoms: erectile dysfunction, decreased libido, premature ejaculation. There are multiple symptoms or multiple dysfunctions when we say male sexual dysfunctions. Okay, so it doesn't have to be erectile dysfunction. So now we'll focus a little bit more on erectile dysfunction. So before we start the discussion, we need to talk a little bit about the process of erection so we can understand exactly how the medications will help with erectile dysfunction. So erection is a self-maintained process. Once it happens, it maintains itself until resolution occurs. So there are three components that we need for good erection. The first component is sexual desire and CNS stimulation. So medications such as sildenafil, for example, these medications are not aphrodisiac. So these medications does not make the patient sexually stimulated. Um, the patient must have sexual stimulation in order to have erection. So this is number one component that we need: sexual stimulation or CNS stimulation. The second element in good erection process is nerve. We need good nerve. Why? Because once CNS stimulation happens, the CNS will send a message